Your doctor has recommended that you undergo hand surgery to treat carpal tunnel syndrome. But what exactly is carpal tunnel syndrome? The median nerve, which carries sensation to the thumb and first 3 fingers, passes through a natural passageway in the wrist. This opening, called the carpal tunnel, is formed by arch-shaped wrist bones and a connecting ligament. Various conditions such as pregnancy, injury, arthritis, and changes in the tendons caused by repetitive motion can crowd the already narrow tunnel, putting pressure on the nerve. This added pressure can cause a tingling sensation in the fingers and the thumb, and may even lead to numbness, pain, and restricted movement. This combination of symptoms is called the carpal tunnel syndrome. When it comes to treating carpal tunnel syndrome, surgery is often recommended after other therapies have failed. If your carpal tunnel syndrome is thought to be caused by repetitive motion or prolonged holding of the wrist in awkward positions, your doctor may first ask you to wear a specially designed protective brace. Other alternatives to surgery may include medication, exercise, and physical therapy. If none of these treatments improve your condition, or if the condition was triggered by a problem that does not respond to these therapies, your doctor may recommend surgery, because increased pain and further restriction of hand function are likely if the condition is left untreated. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth, and an intravenous line may be put in. You will then be transferred to the operating table. Your doctor will scrub thoroughly and will apply an antiseptic solution to the skin around the area where the incision will be made. Next, the surgeon will numb the involved area of the hand and wrist with an anesthetic, either with a local injection or by completely blocking a nerve higher up on the arm. When the operative field is completely numb, the surgeon will make an incision. Skin and other tissue will be carefully drawn aside to expose the carpal ligament. Then the surgeon will cut the ligament, relieving pressure on the nerve that runs beneath it. Finally, the doctor will close the incision with fine sutures. A sterile bandage will be applied, and a splint will be put in place to prevent the wrist from moving while healing takes place. Most patients experience at least some pain following surgery, but if properly handled, it shouldn't present any serious problems. Pain used to be regarded as an unavoidable side effect of surgery, but today, pain can be managed with great effectiveness. And as the patient, you have an important role to play. Before surgery, be sure to ask the medical staff about the type and duration of pain normally associated with your surgery. Find out in advance about your pain management options. Work with the staff to develop a pain management plan. Discuss your options. There are alternatives to drugs that can lessen your need for pain medication. Ask your doctor for help in finding a pain management class. Many of these workshops teach helpful relaxation techniques, positive thinking, and nerve stimulation exercises. Following surgery, make sure to let your nurse know right away how you're feeling and whether or not you are in any pain. Be specific and help them to measure your discomfort. If you're having trouble expressing yourself, Try to rank what you're feeling on a scale from 1 to 10. Never be shy about asking for help. If you experience pain that just won't go away, report it to the nurse. Pain is an important indicator that helps you and your medical staff understand your body's healing process. Carpal tunnel repair surgery only rarely leads to complications. In a very small number of cases, surgery can result in tendon or nerve damage, causing discomfort or reduced hand function. You should notice improvement soon after surgery, but you may experience some minor pain or tenderness during healing.